Good morning, everyone, and thank you so much for joining us. When I stood before the legislature in January for my State of the State address, I spoke about the physical and mental abuse, neglect, exploitation, and poor quality of care at some long-term care facilities that have severely hurt and in some tragic cases have led to the deaths of too many Arizonans. I urged legislators to join me in addressing this issue head on, making sure that bad actors are held accountable and putting an end to the cycle of abuse against vulnerable Arizonans. Today, with the signing of House Bill 2764, that is exactly what we are doing. I want to be clear. There are many long-term care facilities providing excellent care and following the law, and that's not who we're talking about today. We are talking about the bad actors who, sometimes for decades, have been allowed to evade accountability and oversight, have actively broken the law, and have woefully failed to provide their residents the care they deserve. We've all seen the headlines. An employee whistleblower sounding the alarm about consistent mistreatment of patients, family members concerned about bruises or other injuries on their loved ones, and in one tragic incident, the death of a patient after being beaten by another resident. Today, we are joined by Kathy Major, the daughter of Joanne Thompson, who lost her life because of neglect and inadequate care. That she is standing here today is a testament to our state's failure to protect the vulnerable and why this legislation is so important. Your mother should still be with us, and I'm so sorry for your loss. I hope this bill will save others like her. There are many problems within the long-term care system that have allowed these incidents to happen, get swept under the rug, and facilities to move on with little to no accountability. There is a dire need for real repercussions. Right now, the maximum punishment for a violation is a $500 fine. And even worse, facilities can continue operating without paying that fine. With this legislation, the penalty will double to $1,000 per patient impacted, and the Arizona Department of Health Services will be able to add additional penalties based on the scope and severity of the violation. It will also require facilities to pay these fines to stay licensed. We also know that many of these facilities transfer licenses to another person or close altogether to evade punishment, leaving families and victims without an avenue for justice. With this new law, the Arizona Department of Health Services will be able to deny a transfer of license for anyone with pending fines and can continue with legal action even if the name changes or the facility closes. Now, families and victims will get the answers they deserve, and we'll be able to stop bad actors from continuing their behavior in an endless cycle. It is impossible to overstate how beneficial this legislation will be for creating a healthier and safer Arizona. The problems we've mentioned today aren't limited to just one or two types of facilities and are not unique to long-term care. This bill provides critical reforms for all healthcare institutions. It will help the Department of Health Services support Access's efforts to crack down on fraudulent healthcare facilities which use illicit billing practices to fuel the sober living home crisis. This bill closes the loopholes bad actors have used to continue avoiding detection and enforcement. I'm confident that this legislation will help restore trust and accountability in our healthcare institutions and help Arizonans get the quality of care they deserve. We are joined today by leaders and advocates who have been fighting for much needed change, and I'm so grateful for their many years of work. Because of your dedication, we were able to take this first step to protect Arizonans. I'm extremely proud of the work we've done to get here, but the work is not over. These issues have highlighted an underlying problem with the way the state has allowed our healthcare system to function. Today, I ask that all agencies, departments, and legislators join me in recommitting ourselves to transparency, accountability, and action. It should never have taken this long to act when these stories came to light. We have a responsibility to ensure the health and safety of all Arizonans, and this legislation is just the first of many steps that we'll take to get there. Kathy, this is for your mom and all the other Arizonans who deserved better, who went into these facilities seeking help but received excuses and substandard care. Representative Dunn, thank you for taking this on in the legislature. This is exactly the kind of good we can do when we work across the aisle to solve tough problems. Governor Lewis, tribal leaders and indigenous communities, thank you for your persistence in calling for action on this issue and for being partners in making sure this legislation addresses the issues at hand. Dana Kennedy, I can't thank you and your entire team at AARP enough for your tireless advocacy on this issue and for being a constant voice for vulnerable Arizonans. And I also want to thank Representative Longden, who wasn't able to join us today. She played such a key role in getting this off the ground when she was in the legislature. We miss her at the Capitol, but this legislation is the culmination of all her hard work over the years, and we wouldn't be here today without her. And with that, I'm going to turn it over to Governor Lewis. Thank you.
Skugsiatic, good morning. As governor of the Gila River Indian Community, I'm pleased to be here and joined with Councilwoman Nada Salaya, Councilwoman Lelena Jackson, and Senior General Counsel Sunshine Manuel. I'm pleased to be here with Governor Hobbs and everyone behind me today as this bipartisan bill, House Bill 2764, is signed into law. As a tribe, as a state, it is our most profound obligation to take care of our most vulnerable populations. It's critical that those who are suffering with behavioral health issues and with substance abuse issues can seek the help they need in a safe and supportive environment, one that leads them on the path to true recovery. We know the issues that Arizona has faced, and we know that tribal members have been specifically targeted and placed in unsafe and abusive facilities. This bill will make it easier to report such conditions, will increase fines to penalize those who seek to take advantage of those who need assistance, and will provide additional resources to deny or pursue legal action against facilities that are found in violation of the standards required for residential facilities. Now, this bill will bring transparency and it brings accountability. This bill is an important step in our efforts to make sure our tribal relatives and members get the treatment they need in a safe environment. But we have to continue to work together. And I know that Governor Hobbs is committed to working with our tribal governments, social services officials, and legal counsel to make sure that we continue to address any outstanding issues that have put our most vulnerable relatives at risk. I look forward to continued partnership to protect the most vulnerable people, crack down on bad, predatory actors, and ensure the families standing here and families across Arizona never have to dread receiving a call, reporting abuse, or worse. And if they do, the people responsible will be held accountable. Thank you, Governor Hobbs, for your leadership on this bill, and thank you to all the members of the Arizona legislature on both sides of the aisle that worked so hard to pass this legislation to bring accountability and transparency to our residential and recovery treatment systems. Now I want to bring up a good friend and a tremendous advocate who made this bill possible, Representative Dunn.
Good morning. Thank you, Governor Lewis, and thank you, Governor Hobbs. Thank you for hosting the signing ceremony today, and more importantly, your recognition of the importance of enhanced memory care services, which you highlight in your State of the State address. I didn't realize the journey I would be on when former Speaker Bowers appointed me and former Representative Jennifer Longden to oversee an ad hoc committee on the abuse and neglect of vulnerable adults in 2019. From that committee, Collectively, we in the state legislature passed several meaningful reforms, including an Auditor General's report on adult protective services released last fall. House Bill 2764 is a prime example of working in bipartisan fashion to tailor the correct amount of regulation to equip our health partners in enhancing services to provide the best care possible. The memory care patient population continues to rise in Arizona, and our state needs to be a leader in providing high-quality services. HB 2764 will positively impact directed and assisted care services to over 60,000 Arizona citizens that are truly thankful. It will ensure that individuals with memory care needs receive the highest standards of compassionate and competent care, establishing crucial training requirements for memory care services, and importantly, it will cut down on bad actors in the industry. Speaker Toma, President Peterson, and the Health Committee chairs were instrumental in shepherding this large and complex bill through the session, and it could not have been done without their help. I also need to thank House Healthcare Policy Advisor Emily Mercado and my assistant Andrea Allen, for this could not be happened without their help. I appreciate the governor's policy team and the Department of Health Services staff for remaining at the table weekly as we worked with all the stakeholders, including representatives from the over 2,000 facilities that provided these much-needed services, along with advocates from AARP, the Alzheimer's Association, and the firefighters. I'm also appreciative that Governor Hobbs is signing the bill today so we can implement these necessary reforms and improvements and raise the standard of care and protection that our most vulnerable citizens deserve. Most of all, I want to say thank you to all those healthcare workers who day in and day out provide much-needed services. A champion is one who fights or argues for a cause for someone else, and you have all been champions for your cause, speaking for those who can't speak for themselves. As I reminded the group repeatedly, we are doing this for the patients and their families, and we cannot and we will not forget that. And now I'd like to introduce Danny Kennedy with AARP.
Good morning. First, I'd like to thank Governor Hobbs for making this one of your top priorities this year. For AARP, this is an issue we've been focused on for the past 5 years, and it has been great to partner with you and your team to get this done. Going back to January, it was exciting to hear your State of the State, where you addressed your plan to advocate for a package of bills to ensure that assisted living and other long-term care operators cannot hide or erase their violation history, have increased fines fitting of bad actors, and standardized inspections and establish minimum training requirements for Alzheimer's, dementia, and memory care. Thanks to you, your policy staff, and Representative Dunn and others today, you fulfilled this promise. I want to thank Kathy and the other family members who reached out to AARP or the Arizona Republic and other news outlets to share your story. I'm sorry for your pain and how these facilities failed to protect your loved ones. Your courage fueled our passion at every single stakeholder meeting. You held us accountable to speak up for you, and we never forgot that. I want to thank Representative Dunn. We didn't know each other 5 years ago, but you have my deepest respect. You're an amazing elected official, and I want to thank you from the bottom of my heart for your tireless work and dedication to make sure we never lost sight of why we sat at the ad hoc committee for vulnerable adults starting in 2019. I would also be remiss if I didn't also thank Speaker of the House, Rusty Bowers, who formed this committee with co-chairs Dunn and former Representative Jennifer Longden. This is where the work started, and when we transitioned to weekly stakeholder meetings, we got it done. Even though at times it was painstaking. I also want to thank my team, with special thanks to Brendan Blake and Alex Juarez. We wouldn't be here today without your work and dedication. I also want to add that AARP Advocate Arizona not only applauds the bipartisan passage of 2764, but that in the House, every single member voted for this bill, all 59. There was only one no vote. This rarely happens in the current political climate. This has never been a partisan issue. This is a significant piece of legislation aimed at enhancing the safety, oversight, and quality of long-term care across Arizona. Representative Dunn's legislation protects the rights and well-being of residents, families, and care providers through measures that expand safety standards, increase regulatory oversight, and elevate quality of care guidelines. House Bill 2764 addresses systemic issues in Arizona's long-term care system by critically improving standards of care and enhancing regulatory oversight. This legislation will not only protect vulnerable adults and Arizonans today, but in the future. Thank you, Governor Hobbs. Thank you to your team, and thank you to Representative Dunn and all the legislative staff and advocates. This is a demonstration of our state's dedication to improving long-term care facilities and ensuring transparency, safety, and quality care for all residents. It is our hope that when a loved one moves into a long-term care facility, that their loved ones are able to rest at night. We are so much better off today because of all the work that has gone into this bill. Thank you. I now want to introduce Kathy Mazer.
Okay, wow, I'm going to need a second. This is pretty incredible. Good morning, everyone. Almost 3 years ago, I lost my sweet, beautiful mother when she was brutally attacked by another resident in the memory care facility where they both resided. At the time, I made myself 2 promises. The first was I would live every day in a way that honored my mother and her memory. The second was I would do my best to promote change in the long-term care industry and improve circumstances for our vulnerable elderly. To that end, I reached out to the Arizona Republic in the hopes that sharing my mother's story would raise public awareness as well as garner the attention of people with the ability to make things happen. Investigative reporter Caitlin McGlade listened, and I'm pleased and proud to be a part of the Republic's award-winning series, The Bitter End, and grateful for its incredible impact. As the saying goes, no one comes into your life by chance. Our paths cross for a reason. Eventually, I came in contact with Dana Kennedy and Brenda Blake from AARP and found another opportunity where sharing my mother's story and my willingness to fire off dozens of emails to senators and representatives could help make a difference. For years, countless individuals have been working hard on meaningful long-term care reform. Sitting with some of them on Thursday when House Bill 2764 passed and listening to Representative Dunn's rousing speech was a thrill I will never forget. It's also one I hope to repeat in the future when more meaningful changes are made. Today, we've done right by improving the quality of life for our loved ones residing in facilities and taking strides to keep them safe. I'm deeply honored and privileged to be here and participating in this momentous event. I thank Governor Hobbs for her support and everyone who had a part in helping me keep my promises to my mother. Thank you.
If everyone wants to just take a big step in. Take a big step back.